Good afternoon, and thank you for joining us for this webinar. I welcome you on behalf of the Pan-Caribbean Partnership Against HIV and AIDS and the Director, Mr. Derek Springer. My name is Vivian Rockham, Senior Project Officer of the 10th European Development Fund Project at the PANCAP Coordinating Unit. This is our third of 4 webinars for parliamentarians. The objective of these webinar sessions is to share current evidence, implementation experiences, and best practices in creating an enabling environment for the HIV response. Just to remind you, PANCAP has been involved in discussions with parliamentarians through a series of consultations since 2013, which informed the development of the Justice for All program. The aim of the program is to promote activities consistent with the United Nations Universal Declaration of Human Rights, to which all Caribbean countries are committed. More specifically, it is intended to achieve one of the goals of the UN High-Level Meeting Political Declaration of 2011, which is to reduce stigma and eliminate discrimination against people living with HIV, and to uphold the human rights and dignity of all. The Justice for All roadmap with 15 actionable elements was endorsed by the CARICOM Council for Human and Social Development. In September 2014, the CARICOM Council for Human and Social Development agreed that the elements should be implemented in short, medium, and long term. The Justice for All roadmap revolves around 5 principles. First being enhancing family life and focusing on those in need. Second, increasing access to treatment and affordable medicines. Third, reducing gender inequality, including violence against women, girls, and adolescents. And fourth, promoting prevention with special reference to sexual and reproductive health and rights, including age-appropriate sexual education. Finally, the fifth, implementing legislative reforms for modifying AIDS-related stigma and discrimination. For those of you who would like to have additional information on the PANCAP Justice for All program, we advise that you visit the PANCAP website. Just a few housekeeping notes before we proceed. Your mics are muted. If you have questions during the presentation, I encourage you to type these in. We will address them during the question and answer segment after the presentation. This webinar will be recorded and shared on the PANCAP website. We will notify you when this is shared. Once again, welcome. Today's webinar is titled Parliamentarians' Role in Monitoring HIV Budget Allocations. It is my pleasure to introduce to you our speaker, Dr. Frank Anthony. Dr. Anthony is a consultant contracted by PANCAP to provide technical assistance to parliamentarians to strengthen coordination on human rights issues to reduce HIV-related stigma and discrimination. Dr. Anthony is a medical doctor, public health practitioner, and a member of Parliament for more than 12 years. He served on various committees in Guyana and is also a serving member of the Parliamentary Management Committee and Constitution Reform Committee. I now want to hand you over to Dr. Anthony.
Thank you very much, Vivian. Thank you very much, Vivian, for that warm introduction. As you pointed out in your introduction, this is our third webinar in this parliamentary webinar series, which was developed to provide Caribbean parliamentarians with information relating to the HIV pandemic. These webinars is part of a program funded by the 10th EDF as part of the PANCAP Justice for All program. Parliamentarians, as we all know, operate in 3 broad domains, namely the legislative, representational, and oversight domain. In this webinar, we will focus primarily on the latter, that is, the oversight domain. HIV, as we all know, remains a significant public health threat. Despite the significant progress that we have made in the region, it is still a public health threat. UNAIDS Fast Track has established targets, more popularly known as the 1990 targets, and it is established that we should arrive at 1990 by 2020. In 2017, the results were published globally for the first set of targets. And in terms of the global picture, the first 90, that is people knowing their status and having been tested, was at 75%. The second 90 of people receiving ARVs was at 59%. And the third 90, persons who were receiving treatment being virally suppressed, was at 40%. And this is the global picture in 2017. When we look at what has happened in the Caribbean, in the first 90, we are at 73%. In the second 90, we are at 57%. And in the third 90, we are at 40%. In each of these parameters, the Caribbean is slightly behind what is the global average, excepting for the third 90, where it is basically the same. So if we are really going to achieve these objectives of arriving at 90-90-90 by 2020, then of course we'll have to scrutinize our programs more effectively. Why should we evaluate? Why should we monitor and evaluate our programs? The overall purpose of monitoring and evaluation is really trying to get a measurement or an assessment of performance in order that we more effectively manage outcomes and outputs. Performance is defined as progress towards achieving a particular result. And if done properly, monitoring and evaluation can help us to improve efficiency, enhance performance, enhance outcomes for public expenditures, ensure informed decision-making, and support accountability. This is why, as parliamentarians, we should all be interested in establishing a framework or a system for monitoring and evaluating HIV programs at the national level. One of the things that was recently done was a survey of parliamentarians. And in this survey, we tried to get a sense of how parliamentarians feel about their oversight role. And parliamentarians were asked a number of questions. And these questions include, the first one, in your opinion, are budgetary allocations for the national HIV response adequate? And 67% of the parliamentarians said that it was inadequate. The other 33% felt that it was adequate. The other question that was put to regional parliamentarians was really, is there a parliamentary review of the expenditure? And 78% of those interviewed said that there wasn't any review that was done at the level of the parliament, while 22% believed that there was a review. And then one question that was asked was whether any reports were submitted on an annual basis to the parliament on the HIV program. And all parliamentarians responded that there were no such reports. So you can see this really is showing that parliamentarians have to do a little bit more in terms of how they scrutinize the national program. And so this is an area we felt that we should talk a little bit more about so that parliamentarians can better understand why it is important and what they should look for when they scrutinize HIV programs. So we would start off this particular aspect of the webinar talking about how do we monitor and evaluate. When we talk about monitoring, what do we mean by monitoring? And when we talk about evaluation, what is it that we are talking about? Monitoring can be defined as a continuing function that aims primarily to provide the management and main stakeholders on an ongoing intervention with early indications of progress or lack thereof in the achievement of particular results. So basically, monitoring is something that is done continuously, and the persons who are monitoring will look at particular indicators and to see whether or not those indicators are being accomplished or not. In terms of evaluation, evaluation is a very selective exercise that attempts to systematically and objectively assess progress towards and the achievement of particular outcomes. So to better understand monitoring and evaluation, perhaps it is good to look at the M&E framework. And the framework looks something like this. We can broadly define look at the framework in three broad areas. And that is, before you tackle a particular issue, you would want to accumulate data on that issue. And so we are looking at the very left of this framework, where we are doing the assessment and planning. In terms of assessing, you would want to do things like situational analysis, a response analysis, stakeholders analysis, resource analysis, and so forth, and come up with a collaboration plan. So these are all the types of data that you would need if you are going to plan a particular program. And then once you have this, it would help you then to develop a particular program. In this instance, we're talking about HIV programs and maybe specific aspects of HIV programs. For that, we would need inputs, we would need activities, we'll need outputs. The inputs really are things like staff and funding and the material that you'll use and facilities and so forth. And then you plan activities. What are the specific activities that you'll want to do to help you to accomplish your output? And then we'll look at having done the program, then the program should lead us to a specific outcome or an impact. And these can be monitored with data, biological or behavioral data that we might want to use. So using this maybe framework, one of the things that we can perhaps look at is, for example, we recognize that stigma and discrimination is a major issue in almost every Caribbean country. And this has been shown with many studies that have been done across the region. And out of these studies, one of the things that was prepared were what we call LEAs. And these are legislative environmental assessments, which would have shown that there are stigma and discrimination, primarily based on our laws and the policy environment that we have in various Caribbean countries. Now, one of the things that CARICOM would have done, having known this, is that it would have helped draft a model piece of legislation and then tried to get countries to use this model and to incorporate it into domestic legislation. So this whole program of trying to get people to use this model, we can consider that as part of our program, the programs that we're trying to implement to change the legislative environment. And if that is successful, then one of the outcomes that we'll see is obviously a reduction in stigma and discrimination once these laws are implemented at the domestic level. So this is just one example. I mean, we can look at other aspects of other aspects of the HIV response. Now, this is giving us the framework, but looking at it in perhaps a different direction. Again, it speaks to problem identification, and out of problem identification, we move to inputs, and then monitoring and evaluating national programs. We want to know whether or not we are doing the things right. So here at the top here, we look at the outcomes. Are the interventions that we are using, is it working? Is it making a difference? And then of course, outcomes and impact. Are collective efforts being implemented on a large enough scale to impact the epidemic? For example, the coverage, surveys, surveillance, and so forth that we are doing. So this is just another way of looking at that framework. Now, one of the things that we want parliamentarians to focus on is more on the outcomes and the impact. The other parts of the response, really problem identification, inputs, and so forth, these would be done primarily by other stakeholders, people who are in direct management of the programs. Might want to look more closely at inputs. Is the inputs enough, and things like that, and focus to ensure that these programs are better managed. Parliamentarians, on the other hand, would want to see whether we are accomplishing the end results that we set ourselves, and therefore they would look more at outcomes and impacts. And that is something that we'll want to encourage our parliamentarians to focus on. Now, from the survey, one of the things that have been pointed out is that while programs are being done in the country and maybe reports are being generated, these reports do not necessarily come to the parliament, or there isn't a mechanism for programs to report directly to parliament. And this is something that is lacking, and perhaps because of that, that is why 100% of the parliamentarians that were interviewed said that there are no reports that are coming to the parliament. So one of the things that perhaps parliamentarians should think about is how do you establish such a mechanism to ensure that what is happening in the country as it relates to HIV and AIDS, that we are able to, on an annual basis, to bring this information to the parliament. For other things, we know that other sectors of government and so forth, or specific programs would normally do an annual report and send that to the parliament, where it is laid in parliament and then discussed by parliamentarians, either as in the form of a debate, or sometimes it goes to a special select committee where these discussions can occur. Now, what is it that we should ask parliamentarians to monitor and evaluate? There are many, many aspects of the epidemic that we can look at, but what I did here is to narrow it down to maybe 4 important components. Not to burden you with everything, but just maybe to look at 4 aspects of what can be monitored. And the first one that I think we should look at is international commitments. The second one we can look at is stigma and discrimination. And then the third is perhaps to look more at programmatic outcomes. And then, of course, none of these things can be achieved if we don't put adequate resources to them. So each of these areas, we'll probably look at it in a little bit more detail, and we'll go through them, and then we'll see what we can do for each one of them. So we'll start with international commitments. And here again, countries tend to make or sign on to a lot of agreements. And in many cases, our countries have signed on to a lot of United Nations treaties dealing with human rights. So for example, the International Convention on Economic, Social, and Cultural Rights is a very important UN charter that goes back to 1966. And almost all the countries in the Caribbean have signed on to this charter. And from time to time, they're obligated to send reports to the UN to see whether they're in compliance with these charters. Another very important charter deals with the International Convention on Civil and Political Rights. And again, compliance is monitored on a periodic basis by the UN. Sometimes countries, while we have signed on to these charters, are not in compliance or haven't complied fully with some of these things. And some of these charters have also, you have what is called optional protocols that countries were asked to sign on to. And in some instances, we have signed on to them, but again, we have not been complying, with a lot of the provisions in these optional protocols. But here again, one of the things that parliamentarians can do is to recognize what are the international obligations that the countries have and whether they are in full compliance and whether they've been reporting as per those periodic schedules that have been established. Why this is important? Because a lot of the work that is being done in terms of HIV and AIDS has to do with human rights. And if we are in compliance with these international human rights obligations at the domestic level, then we would have been able to create a more enabling environment for the public health response to HIV. Another very important obligations that we have is that dealing more directly with HIV, from around 2001, the United Nations General Assembly would have brought together countries to sign on to a political declaration. The very first such declaration was done in 2001, and that was a declaration of commitment on HIV and AIDS. This then was followed by another declaration, which was done in 2006. And in 2006, it was called a political declaration on HIV and AIDS, where government and regional and international bodies made international commitments on what they will be doing in terms of the epidemic. And again, in 2016, the political declaration on HIV and AIDS on the fast track to accelerate the fight against HIV and to end the AIDS epidemic by 2030 was signed on to by a number of countries. But again, we signed these agreements, and I'm not sure that many of our parliamentarians have been following to understand the implications of what we have signed on to. So this is at the global level. We have been able to sign on to these agreements, but in the region itself, in the Latin American and Caribbean region, there have also been other agreements that the region has been working on. And such agreements include the LAC-1 agreement, which was done in Mexico in 2014. And we in this region, we were able at that time in 2014 to come up with our targets for the 90-90-90. How many people who have HIV would know their status, how many people are on treatment, that's the second 90, and how many people are virally suppressed, the third 90. So since 2014, this region has been able to establish its own target for the region as a whole. And then that was broken down to what would be for Latin America, what would be for the Caribbean, and then countries themselves have broken that down for targets at the national level. The LAC-2 meeting also came up with a set of goals for prevention, and this was done in 2015 because we recognize that if we are going to sustain the gains that we've made, then a lot more efforts would have to go into prevention. And again, all the countries of this region would have signed on to the indicators that came out of the LAC-2 meeting. The third LAC dealt more with sustainability, and this was done in 2017. So we have many international agreements that countries have signed on to. And what we have to look at is whether or not we have been able to comply or are complying with what was established in these agreements. So let's look at the Fast Track 2020. What is in the Fast Track 2020? In Fast Track 2020, one of the things that we looked at is that how this document was structured. There are 10 commitments that countries signed on to. And under each of these commitments, there are a number of indicators. So we have 10 commitments with approximately 72 indicators. What is important is that the first commitment deals with 90-90-90, and globally what we are looking at is to achieve 90-90-90 by 2020. And if this is accomplished, then we will ensure that 30 million people living with HIV would have access to treatment. The second commitment has to do with how do we eliminate new infections, especially in children. And so we want to ensure that 1.6 million children would have access to treatment. So what we have is the Fast Track has given us some very pointed indicators. And as I said, there are 10 such indicators. So these are the commitments that were set out in that 2016 UN political declaration. Now, in all of this, what we are aiming for is to achieve this by 2020, which is next year. But if we fail to accomplish this globally, what we'll end up having, and if we go on maybe and extend these targets to 2025, what we are looking at is an additional 2.1 million new infections that would occur, and an additional 1 million deaths, AIDS-related deaths, that would occur if we don't get to our targets by 2020. So you can see the impact would be quite dire if we don't achieve those 2020, those targets for 2020. So the other area, so we want parliamentarians, therefore, to focus on the agreements, the international commitments that the countries would have made, and to evaluate whether or not our national programs are reaching those targets based on the commitments that we would have made. The second one we want to look at, or the second group of things that we want to look at, is whether or not our programs are achieving what we set out to achieve. And that is whether we are accomplishing things like the 90-90-90 and so forth. So the picture in the region in terms of 90-90-90 is that people living with HIV who know their status, by 2017, we were at 73%, which means that if we are going to cover that gap, we have to reach at least another 54,000 more persons before 2020. Persons who are living with HIV and are on treatment, in terms of coverage, we are at 57%, which means we have to put another 74,000 persons on ARVs before 2020. And again, for those persons who are receiving treatment, only 40% of them are virally suppressed, which means that we have to get another 103,000 persons virally suppressed by 2020. Now, when we look at some of the countries, we would see that a number of things are happening. In some cases, from the UN AIDS report, that countries have not provided enough data to the UN, and maybe that is why they have not been able to publish what is happening with, say, the first 90. So, for example, in Trinidad and Tobago's case, the reports only show how many people are on treatment. And in the case of Trinidad, you have about 62% of those persons who know their status are getting ARVs. In terms of Jamaica, if they are going to achieve the very first target, they would need to put an additional 5,050 persons, get them tested. And for the second 90, they'll probably have to do maybe about 15,880 persons they have to put on ARVs. And to get them to be virally suppressed, to achieve the third 90, they would need to add another 18,874 persons. So you see different countries, they're doing, differently in terms of how they're accomplishing the 90-90-90. One of the notable things, however, is that as a region, we have seen from a decline from 2010 to 2017, a decline in terms of new infections. And we have seen an 18% decline in new infections. And we have also seen a 23% decline in the number of deaths. Now, this is very important. And while there have been a decline, there's an interesting thing that we have also noticed, that the decline has not been even in all the countries of the Caribbean. So right now, when we look at the countries that are most affected, we can see new infections, 90% of the new infections happening in 4 Caribbean countries, namely Cuba, the Dominican Republic, Haiti, and Jamaica. And this pie chart gives that overview. And then in terms of deaths, 87% of the deaths are occurring in AIDS-related deaths, that is, are occurring in the Dominican Republic, Haiti, and in Jamaica. Now, what is also important to note is that for key populations, we have gay men and other men who have sex with men accounted for nearly a quarter of the new infections in 2017. And in total, key pops and their sexual partners represented 2/3 of the new infection. And this is shown in this particular pie chart. So again, if we are going to do something about our programs and what we are doing in our country, we have to focus a lot of our resources in terms of key pops and also the coverage that we are extending to some of these populations. And then another area that we have to look at as parliamentarians is to look at stigma and discrimination. And one of the things that we know, the drivers of stigma and discrimination, has to do with discriminatory attitudes, it has to do with our laws, and of course the services, whether when people come to our clinics and so forth, that they can access services without discrimination. And these drivers have led to manifestations where we can see that people who are discriminated are being beaten and things like that. They experience more violence. They experience more discrimination in healthcare setting, discrimination in employment, and so forth. Now, one of the things that really tests people's attitude is what is popularly known as the vegetable test, whether people would buy vegetables from someone who is HIV positive. And in Jamaica, when that test was run, 71% of the persons said they would not buy vegetable from a vendor who is living with HIV. So as you can see, and there are other countries here that are on the graph, as you can see, attitudes towards stigma and discrimination is still high in the region. When we look at our laws, you can see here that laws dealing with consent in the Caribbean, we can see that we have laws that prevent young people from accessing sexual and reproductive health. We have here again laws that, because of fear, we have laws that criminalize transmission. And you have 9 Caribbean countries that still criminalizes transmission. This particular graph shows persons who have experienced violence over the last 12 months. A lot of them don't report it. And again, this is a big issue in the region. So you can see stigma and discrimination has direct impact on how people, that can affect the public health response to the epidemic, because we want to get to key pops, but our laws prevent us from getting to key pops. And because they experience discrimination at the level of healthcare settings, at the level of reporting violence and so forth, you still have that problem. Now, the other major area that we should look at is dealing with budgets, because if we don't resource or we don't put adequate resources to finance our response to the epidemic, then obviously a lot of the good things that we want to do, expand our programs and so forth, would not happen. And this is another area that parliamentarians need to look at. From the survey, one of the things that we pointed out was that a lot of parliamentarians, while they would have discussions at the level of the parliament, they don't get into the nitty-gritty about programmatic allocations. And so while they might have a general allocation for the Ministry of Health, they don't know the details of how much of that monies are going to the HIV program. So this is something that parliamentarians would have to look at if they can make a meaningful contribution in terms of whether the HIV response is receiving adequate amounts of money. And this here is just a graph to show what is happening in the region. Again, we see that there's a decline. International donor funding is being reduced. The Global Fund is being reduced. Bilateral funding from the United States is being reduced. And what we are doing is there's a slight increase in domestic funding. So obviously, if we are going to pick up the slack, it means that we'll have to budget more monies to be able to pick up that slack. Just one example of, there are a number of national health accounts that were done across the region. And when you look at HIV funding, for example, the source of funding, let's take Suriname, for example, you would see that 68% of the funding comes from government, while about 16% are coming from donors. And this is being slowly reduced. The donor component is slowly being reduced. And what is happening is more governments have to take up the response. But when we come from that and we look at the types of expenditure, we will notice that 68% of the money is being expended on HIV is going for curative care, while 17% is being spent on preventative care. Now, one of the targets that has been established by the UN in terms of the fast track is to move preventative care to closer to 25%. So you can see in this instance that in the case of Suriname, that they need to reprioritize or reallocate their monies to have more monies going into preventative care so that we can prevent new infections from occurring. A similar pattern can be seen in many of the other Caribbean countries. In the case of Barbados, government funding is close to 87%, but in terms of prevention, they're probably closer to that 25%, but they're still at, say, about 22% being spent on prevention of HIV infections. So in the region, when we look at some of these health accounts, we can see that how monies are being spent and perhaps how to reallocate some of these monies so that we can get better results for the money that is being expended. So this is an area that I think parliamentarians ought to look at, because a lot of times we don't focus on these details. We are missing this picture of what is going on with our HIV response. So this is the amount of money that is currently being spent. Now, one of the things that and most of our parliaments, when we do budgets, we look at historical budgets. So whatever has been allocated, we put a small percentage and we increase that for the following year. Now, sometimes this is not adequate to respond, because in many of the countries of the region, if we are really going to scale up the response, we have to front load more of the monies, and which would mean that we need much more money up front than is currently happening. So if we use the historic budget as a benchmark, then this might not be enough for us to scale up the response and for us to fill the gap that is being left by the donors. So again, this is something that parliamentarians should take a closer look at, because it can mean that we are lagging behind in our response, or it can mean that we are putting adequate amounts of money to ensure that we cover our response properly. So in concluding, if we are going to really end AIDS by 2030 as a public health threat, then we really need parliamentarians to step up their leadership role across the region. And one way of doing that is to start paying closer attention to how we monitor our national response. So I'll end here for now, and I'll take some questions that you might have. Thank you very much.
Thank you very much, Dr. Anthony, for a very informative presentation. Thank you for outlining the importance of M&E in relation to parliamentarians' oversight role and the key areas of focus, particularly outcomes and impact. Also showing how M&E serve in the assessment at the country level in relation to performance and countries' progress towards achieving targets such as the UN 1990 targets, and also increasing compliance of countries' in terms of measuring compliance of countries' international commitments. And for example, you mentioned the UNAIDS political declarations, and not forgetting assessing countries' resource allocation to prevention, treatment, and care programs. So we'll now take a few questions and comments. I'll start with the last one, which speaks directly to the last slide with the information on Suriname, and the question would be, what are the recommended benchmarks that parliamentarians must pay close attention to in relation to the distribution by HIV spending categories? And a follow-up question would be, what are some of the parameters to look out for as it relates to sustainability and country ownership?
Well, that's a very good question. As I said, there are international benchmarks that have been established, and one that has been established by the UN is that countries should upgrade their spending so that they're spending more on prevention. Because a lot of countries focus on the curative side, and if you're spending only on the curative side and neglecting prevention, then we'll have people getting infected, and you'll have more people being added to that pool in terms of more people that you'll have to get medication for. So as I said before, the UN has set a benchmark that at least 25% of your budget should be spent on the preventative side. In the case of Suriname, the one that you referenced, we see from the health accounts that Suriname has been spending about 17%. That's a reasonable amount of money that they're spending. But if they're going to meet that UN benchmark, then they have to upgrade that a little bit more and get to 25%.
All right, thank you very much, Dr. Anthony. The second question would be, the survey also showed that there is limited interaction between parliamentarians and the national response. That's the National AIDS Program Secretariat. This can be an important mechanism for monitoring of the response. What would be suggested and proved mechanism for parliamentarians engaged with the national response for effective monitoring?
I think a couple of things can be done here. You know, some years ago, one of the things that we had was a presidential commission on HIV and AIDS. And because it was a presidential commission, you had a lot of parliamentarians who were involved at that very senior level. The president heading the commission. In some cases where countries do not have presidents, but they have prime ministers, the prime minister would be chairing that commission. And a number of parliamentarians and senior people would have been involved at that level. For whatever reason, those commissions and have dwindled away. And that high-level type of intervention has slowly disappeared. But the public health threat of HIV is still here. And we need to get all the senior people involved in at least understanding what is happening with the HIV, with the epidemic. So one of the things perhaps that we can look at is to reinstitute back, for those countries that don't have them, the presidential commissions or prime ministerial commissions on HIV and AIDS. So that might be one level that we can look at. The second level can be that, again, if we want to involve parliamentarians, we must have a mechanism that get them to participate. And one way we can do that is to have periodic reports that is generated by the national program and is laid in Parliament. So that is on the side of the programs, they can do the report and send them to Parliament. This is happening for other sectors. The other thing that can be done is that from the Parliament side is to have maybe one of the committees, like the parliamentary committee that deals with health, can examine and can hold hearings as it relates to HIV and AIDS, and invite stakeholders such as the implementers of the national program to come and make presentations so that parliamentarians then are more updated with the information. But what the survey clearly showed is that there's a disconnect between parliamentarians and the national response. And if we are going to change that, then we have to build some connection between parliamentarians and the national response, and there are various mechanisms, as I've outlined, that we can use. These are not, those that I've pointed out is not an exhaustive list. I'm sure we can come up with other methods of how we can bridge that gap that currently exists.
Okay, thank you very much. And the third question would be, well, there's a comment before the question, and it says parliamentarians need to monitor, but even before monitoring, they need to advocate for the necessary tools to be made available to them so that they can adequately monitor. And they provided an example. They said the example is they should have regular access to HIV reports. The survey showed that no HIV support reports are submitted to Parliament. So how can they monitor and evaluate?
Well, if no reports are coming, it's going to be very difficult for them to monitor and evaluate. But again, as I said, you know, we have to create interest and awareness. So if we create more interest in parliamentarians, because I think when you speak to parliamentarians generally, and this has come out in a lot of the sensitization meetings that we had around the region, parliamentarians are genuinely interested in ending the HIV epidemic as a public health threat. But while they have that genuine interest, we also have to bring them on board in terms of providing them with the kinds of information that they can use for better decision making. And one such way is that we should periodically give them reports. And also we can invite parliamentarians to come to programs where a lot of these things are being discussed. So at the national level, whenever you have discussions relating to whether it's stigma and discrimination or whatever it is, we should get more parliamentarians to come and be involved. Sometimes it's also important that parliamentarians are able to get down to the levels of the community, the clinics and so forth, and see how these programs are impacting on people's lives. And I think when they're able to see that, they'll have a greater desire of putting more funding. So it's not just a statistic that you're seeing, but you're actually seeing real people and how they're benefiting from these allocations. So I think we need to make the connections between parliamentarians and the HIV programs. And by doing that, I think we'll get greater ownership from parliamentarians to respond to the epidemic.
All right. Thank you very much. And finally, how are parliamentarians able to conclude that the budget for HIV programs is not sufficient, given that they are not involved in the review of expenditure and no report is presented to Parliament? Is there some existing mechanism that would provide, say, information that they can draw to this conclusion? Or you have any ideas? Did the survey provide this kind of information?
Well, I think that's an interesting question. But again, when you look at the aspirations of the HIV program and the additional things that they wanted to do, it's not covered by the current budget. So the historic budgeting, as we call it, is not adequate to scale up the programs. And I think most of the national programs are talking about scaling up. Most of the national programs are talking about introducing new elements of prevention. For example, you have PrEP, and a lot of this has not been catered for traditionally in the budget. So obviously you would need more resources if we're going to introduce these things. For most countries, they're not providing 100% of the budget for ARVs, and a lot of countries now are moving to provide ARVs earlier. So if we are going to move to treat all, obviously we'll need more monies to be provided. And so I think based on these maybe areas of scaling up, that parliamentarians recognize that the current provision that is in the budget is obviously not adequate, and they'll have to add more monies or allocate more monies if we're going to scale up the program and really take control of the epidemic. So that would be my take on it, but I guess others might have used reports such as the National Health Accounts and so forth, and maybe have a more informed way of how much more resources are needed at the level, at the national level. And maybe they have different methods of assessing that. But intuitively, I think most people recognize that these programs would require a lot more resources to get them to function optimally.
Thank you very much, Dr. Anthony, for the insightful presentation and providing answers to these questions posed by participants. This brings us to the end of our webinar. On behalf of the Director of PANCAP, Mr. Derek Springer, and the participants, let me thank our presenter, Dr. Frank Anthony, and you, the participants, for joining us. As a reminder, the webinar was recorded and will be posted on the PANCAP website. This will be shared with the other parliamentarians and the PANCAP partnership. Please do join us for the next webinar titled Adopting the CARICOM Model Anti-Discrimination Bill on May 23rd, where the Speaker of the House for Belize, the Honorable Laura Longsworth, will share with us the Belize process to date in adopting the Model Anti-Discrimination Bill. Also, please stay engaged with the regional HIV response. Follow us on our social media platforms, Facebook and Twitter. Thank you, everyone, and see you at the next webinar.